Yes.
We
I
all
was just thinking of that.
You get measles, you move on. It's just no big deal. But these people, I mean, the Boston Globe, New York Times, Wall Street Journal, so forth, so on, blah, blah, blah. They're all pushing after this event is over. Social separation will be the new norm.
Yeah. Well, I think that's one of the goals.
No, it's definitely one of the goals. But I mean, in your medical opinion, somebody having a slight cold or flu, or what they're calling COVID-19, it can't pass the way they're talking about this, correct?
Right. Absolutely. And so I think there's really two big parts to understand this. And one part is that, and I'm going to say that this is going to surprise people, but there's no conclusive evidence for any virus that it causes disease in humans. So I know that that's a hard pill to swallow, and because we've all observed what we think is contagion, that it would be very powerfully explained if there were some infectious agent that we, coughed and sneezed out and someone around us picked up. But the thing is that there's actually no evidence for that either. And I know it sounds confusing because you've observed it, but did you really observe it? Because did you take the snot from someone's nose and put it in someone else's nose? Or did you just observe that, well, people tend to get sick at the same time, right? So, let me ask you, if you have a family of 4 people, when someone got sick, maybe 2 people got sick, maybe 3 people, but was it that everybody got sick every time? Because if it was so easy to transmit, wouldn't everybody get sick if they're in close proximity? So if you think about it carefully like that, you can see that the explanation is not quite perfect. But I want to bring up something that is going to give you some conclusive evidence about this. And then I also want to talk about possible mechanisms of contagion that could explain what we observe. But this comes from, so I heard a Dr. Tom Cowan, who's another physician that has gone outside of the mainstream health system, and he gave a nice talk, and he referenced this excellent book called The Invisible Rainbow. And this book is about the theory that actually these pandemic diseases may actually be caused by some kind of electricity or electromagnetism. Now, I haven't fully investigated that research, but I plan to. But there certainly is correlation in time that a lot of these pandemics were timed to occur right after or in at the same time as major electric infrastructure projects were introduced, such as the initial electric grid and radar and things like that. And of course, there's talk about 5G with this current outbreak, although I don't want to speculate. I don't think that that's necessarily what's going on.
Real quick, right there. A lot of people, I've talked about 5G. We've all talked about 5G because it's bad.
Absolutely.
It's a military weapon. It's bad. I get that. The only problem, some people are inadvertently timed. All these deaths are from the 5G. It's like, right. But there aren't all these deaths. So we're muddying the water
exactly.
for them, and they're moving forward. There aren't all these deaths.
Right.
I just checked the death list 2 days ago, and it was 5,000 and change. So I was just rounding it up to 6,000. I just checked it now, and it's 11,000. And yes, they will start juking the stats. But the thing is nobody knows anybody. Somebody I know died. Well, they're going to start slapping the label on there because it's going to work to their agenda. These people have massive reach. They just shut down the world with words. It's amazing. But
well, I'm gonna definitely get that because I want to talk also about the testing, and that will help you see how inaccurate these numbers may be. But let me get back to this issue of contagion because it's really important. So in 1918, right around the time of the Spanish flu, or right after the Spanish flu, rather, the U.S. Preventive Health Service wanted to understand how this pandemic spread because they want to be able to protect the public. So I'm going to assume that they had beneficent intentions. So this, like I said, this study was, these studies I'm about to describe were conducted by the United States Public Health Service. So this was not some independent scientist. Okay, this is the government-sponsored research. So what they did is they had 100 healthy subjects, and then they had a number of people who were sick with the flu. And so the first experiment they did is they basically took snot out of their nose. They took the material that they coughed up, and they mixed it up in a solution. Okay. And then they put that solution in the 100 healthy volunteers, and they put it in their nose, they put it in their throat, and they even put it in their eyeballs. So all the proposed mechanisms of transmission they wanted to test, and they wanted to get these healthy people sick. So what happened? None of them got sick. Mm-hmm. Not one person. So they did a subsequent experiment to try and push it further. Okay, so they once again collected these materials from the sick people, and this time they injected it into the volunteers. Okay, once again, no one got sick. So I think they conducted even a third experiment where they wanted to simulate more of a natural transmission from person to person. So in this case, they had the sick person and the healthy subject sit in very close proximity for a period of 5 minutes and talk to each other. And then they had them put their mouths really close, but not touching. They didn't want them to be making out or anything. But then they had the healthy person breathe out as hard they could, and the sick person breathe in as hard as they could, and basically breathed out the sick air into the healthy person who sucked it in. So after this final experiment, once again, none of the healthy subjects contracted the influenza. They went on further to do a similar study in horses, where they actually covered the sick, because animals do get some of these illnesses, and many of these flu pandemics, animals were sick, not necessarily the same time. Sometimes animals get sick like a month or two before the people, and there's no known, passing it back between animals and humans, but it's the same illness essentially. And so they put these bags over the horses' heads and had them sneeze and cough into the bags. So they're filled up with snot and, allegedly germs. And then they used those bags and put food in them for the healthy horses to eat. And once again, none of the healthy horses got sick. So you have this series of experiments where they tried as hard as they could basically to pass the flu to healthy people, and they were unable to do it as hard as they tried.
That's insane.
I know. It's astonishing, isn't it?
I listened to a dissertation on a very similar, but I don't think the same test, and it was the same results.
There have been other instances of this. Like, for example, there were some scientists who were basically looked at the research and that disproved germ theory, and so they were a bit bold and they wanted to test this. So they actually had the bacteria that causes the plague isolated in a test tube, and the plague was passed supposedly by the fecal oral route. And I think this is actually quite possible, because there could be toxins in the fecal matter that could make someone sick without any need for microorganisms. But they had the isolated plague bacteria. And so normally people would get it, they would touch something with feces, then touch their hand to their mouth and eat the infectious material. So if they had the pure bacteria that supposedly causes the plague, and they drank it down, and they did not get the plague.
Wow. So I was at a dinner